I'm Dr. Elizabeth Stroot, physical therapist and owner of private practice specializing in women's health. Today what we're going to talk about is something very important and near and dear to our hearts here at Core Wellness, and that is perineal massage. We're going to talk about what the perineum is, what perineal massage is, how to do it, when to do it, why we do it, and all those spaces in between. If we look at the pelvic floor from the bottom up, you'll see here the vaginal opening, you'll see the anus. That perineal space, the perineal body, is what lies right in between that. The area of your body that we're talking about is that space in between your vaginal opening and your anus. It's a small area of soft tissue that really is an integral part of the labor and delivery process. There's necessary expansion that needs to happen there. And if we have appropriate flexibility and pliability of that tissue, we're able to reduce the degree of trauma that can occur. Why is it so important? Statistics tell us that 85% of women that deliver vaginally will experience some form of trauma to their perineum. That could be in the form of excessive stretching, general swelling, bruising, grazed tearing naturally, or an episiotomy, which is a facilitated cut and tear to the perineum itself. For a lot of women that sustain some trauma to this area, long-term concerns can come up. They can have pelvic floor pain. It can lead to instability through the pelvic floor, which can yield bladder and bowel issues, pain with intercourse. There are quite a few things that come up for women at various points in time. Perineal massage helps the perineal tissue to expand more easily during birth. Like any tissue in your body, really, the more you move it, either by activity or by using your hands with a massage-like technique, you're able to improve the softness, the suppleness, and its response to pressure. If we start applying these perineal massage techniques, there's a wonderful, wonderful outcome that happens where the tissue has that suppleness, that ability to flex and move and stretch, that there's a reduced impact of trauma to the perineum. The benefits of spending time stretching and releasing this area of your body a few weeks before labor and delivery can help the extensibility of the tissue, making it easier for a baby's head to move through the birth canal and crown in order to be fully delivered. A perk of starting this technique at about 34 weeks is that the hormone called relaxin has started to kick in. The hormone relaxin does exactly what its name implies. Specifically, it's helping to relax the soft tissue of the pelvic floor. It's allowing connective tissue to become more extensible so that that skeletal frame has a little bit of play to it as baby starts to drop down into the birth canal. Let's talk about how we do this. So, step one, get relaxed. You can do this with one leg raised on a stool, sitting or lying down. Right now, I feel full enough. Baby feels large enough that getting into some of those positions that I would have thought I would have used at this point at 34 weeks, I just can't get there. But for those of you that are still comfortable sitting and you don't feel like your tummy is limiting your reach, sitting is a great way to do things. In order to treat the area with as little friction as possible, having some sort of oil is going to be really helpful. First, I'd like to ask you to visualize the 6 o'clock position of the perineum and the 12 o'clock position, which is around your clitoris or your pubic bone. Focusing between the 3 o'clock and 9 o'clock positions between the labia is where we're going to begin. When you're ready, begin by making sure you're relaxed and you're comfortable, your nails clean and trimmed. Start by massaging in small circular motions around the whole area to warm the tissue. Place your thumb up to the knuckle inside of your vagina and using your thumb to make small circular and sweeping motions. You're going to work from the 6 o'clock zone to the 3 o'clock zone using your left thumb. Then from the 6 o'clock zone, working up towards the 9 o'clock zone using your right thumb. You do need to be gentle but firm enough that you're working right into the tissue and not just on the surface. Take your time and go ahead and repeat each side 3 to 4 times. So to finish the massage, we're going to use application of some gentle stretches in that 5 o'clock to 7 o'clock zone. Hold each gentle stretch for around 30 to 45 seconds. It's completely normal as you're doing these various techniques to feel a mild prickling or even an aching sensation deep in the tissue. It's very common while you're working on the massage. If you experience any problems whatsoever, such as sharp pain, any sort of severe pain or aching, it just doesn't quite feel right, please stop immediately and take action to speak to one of your healthcare practitioners. This might even feel a little strange when you get started, especially if you're not familiar with palpating your own body in this way. It is normal to feel kind of awkward given that this is a technique that perhaps you've never done before or anything similar to it for that matter. But like anything new, it just takes time, it takes patience, and it takes your continued persistence in trying and relaxing into it. Open the dialogue with your healthcare practitioners. If there's a certain aspect of preparing for labor and delivery that you are unsure of, ask the questions of people that you feel most comfortable with first. They might have an excellent resource. Once you feel comfortable, please give it a go. Start slow, work into it, be consistent. Your later self will thank you, Mama. To learn more about preparing for birth and recovery, please visit us at lansino.com.